I'm on an operation stop bad breath. It's not only body odor that we have to eliminate. We have to stop bad breath as well. Bad breath, I know, is not an easy part, which is why I am here to help you solve that and to create more awareness for you to be able to maintain fresh breath. There are different ways to solve bad breath. You might go through a long process, but at the end of the day, you still achieve a better oral hygiene. There are several factors that contribute to bad breath. Number one, not brushing your teeth properly. Number two, not brushing at all. Number three, eating sour food. Number four, lifestyle habits like smoking and drinking. Number five, tobacco use. Still a lifestyle habit as well. Number six, eating and you are not drinking water. In other words, you don't hydrate well. When you drink water, you enable lubrication in your mouth in order to prevent dry mouth, also known as serostomia, to ensure you don't have bad breath. And more several factors contribute to, even our body mechanism sometimes contributes to bad breath. Like, for example, if you have gastrational diseases like GERD, that's GERD, GERD. If you have gastrational diseases such as heartburn, acid reflux, those type of things also contribute to bad breath. Even diabetes can also contribute to these smells in the mouth. Then your tonsils can accumulate bacteria and turn them to stones, which we even know as tonsil stone. So many things can actually contribute to bad breath. Most time it's not our fault. We have people that take care of their oral hygiene so well, even better than you that don't have bad breath, but still they have bad breath. It's not their fault. Most time it's your body's mechanism or something that is going on inside of you that is causing these things. But with daily practices and little improvement on our oral hygiene, we can get there. We can get to a point where your breath is so fresh. So how do you prevent bad breath? Number one, drink enough water. Always stay hydrated. Drinking water is very good for the body, the skin, and the mind. When your mouth is hydrated, it opens room to more fresher breaths. Bacteria cannot feed in a mouth that is hydrated. This water also flush out toxins and food particles in the mouth, especially when gargled. So always drink water. Number two, chewing gum can actually help you. If you want to curb down your breath or you want to maintain a fresher breath for a longer time, it's one thing to have fresh breath, it's another thing to maintain fresh breath. When you want to maintain fresh breath, chewing gum helps. Number three, having a good oral hygiene. We cannot negotiate this. When you have a good oral hygiene, you open room for good bacteria to flourish. Good bacteria in turn will still help your body. Using the right toothpaste, using the right toothbrushes. Is your toothbrush more than 3 months old? Throw them away. If your toothbrush are looking like you used it to scrub the bathroom floor, throw that toothbrush away. Visit your dentist regularly. Do not negotiate this. Visit your dentist or your dental professionals regularly, at least every 6 months. It's not everything you can cure at home. Most time when we experience pain in our teeth, the problem has already gotten to the final stage. So go and see your dentist so that things that you can avoid early will be avoided, okay? Also, health-wise, be healthy. Watch what you eat. Avoid sugary food. Avoid acidic food. Avoid food that you know that are not good for you. Too much of everything is bad. Once in a while, we can have our sugary food, our this, our that, but keep them on a minimal. After you eat a meal, rinse your mouth with water. Do not forget, brush at least twice a day. Take care of your oral hygiene. And for more oral hygiene videos, always, it's me. Stay tuned in for more. Bye.